welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. One quick announcement before we bring on our guests for today. We do have our symposium coming up at the end of the month on October 30th. So make sure that you grab your tickets for this amazing event. And with that, would like to formally introduce our guest for today, Dr. Denise Howard, who is the Associate Professor of Clinical Obstetrics and Gynecology at Weill Cornell Medicine. As you know, we love questions. So if you have any for Dr. Denise during our conversation, please use the Q&A or the chat feature, and I will make sure that we get to it. With that, thank you so much, Dr. Denise, for being here. So good to have you on.
Thank you. I was excited for the opportunity.
Absolutely. Well, I think maybe a great place for us to start, because I know you have a bit of an atypical career journey, which we love here at Women's Health Tech Wednesdays. Would love if you could maybe share a little bit of an introduction, a background, kind of walk us through your career journey.
Yeah, would love to. I mean, it's long, so I'll try to be brief. I grew up in Mississippi, rural Mississippi. I had the good fortune to attend the University of Mississippi and then Johns Hopkins for medical school and to do an MPH, and then trained at McGee Women's Hospital in Pittsburgh, and then did a fellowship in urogynecology at the University of Michigan. Thought I was on an academic career path and was doing quite well at the University of Michigan, had gotten NIH funding, but then life happens. I got married, I had a kid. I looked at what was required for faculty to actually become tenured and wasn't sure if I wanted to do that. I also was homesick for the South, and so I went into private practice in Georgia and was there for almost 10 years in the Atlanta area. I did general obstetrics. I did a lot of preventative gynecology, but a lot of gynecologic surgery, both pelvic floor surgical things as well as fibroid care. I just took care of the community. So I tried my best to meet the needs of the women in the community. And then got bored, had burnout, and then the 2008 recession hit. My husband had always wanted to live internationally, and we made a big decision and we moved to Abu Dhabi.
Wow.
Yeah, so we lived in Abu Dhabi for 5 years, and then I was in Doha for 4.5 years before coming back to the United States. And my career path then, I switched because I recognized what was happening in women's health in the United States. I started to pay attention when I was trying to transition back and was really shocked by how stagnant we were. There were things that I was doing in preventative health around cervical cancer prevention, around early detection of breast cancer and uterine cancer, as well as maternal health. And I was shocked. There were a lot of shocking stories that I saw and couldn't believe that we just hadn't progressed. So planning to come back, I decided and had an opportunity to come back to academic medicine, but also wanted to be very focused in what I was paying attention to and working on. And so my goal was to try to use technology and innovation to deliver equitable care.
Wow.
There's a lot of standardization that needs to happen. And so that's been my focus as the chief of New York Presbyterian Brooklyn Methodist Hospital. I live and work in Brooklyn, one of Cornell's sites.
Wow. That is incredible. I mean, you have such a wealth of knowledge from academia, from private practice, from, seeing the world through all of these different lenses. I mean, that is what a journey. That's incredible. I know, I mean, there's so many questions that I would want to just pick through kind of almost everything you just said. But the first thing that just quickly comes to mind, have you noticed, because I could just imagine, seeing women's health or just broader, we could just say healthcare more broadly, right? Being in the States versus being internationally, were there kind of these big culture shocks that you noticed, or were there a lot of commonalities in the way that, people are receiving care and things like that?
I think both. I mean, I think there's some things that people will be shocked about. And I think there were two things that I'll highlight that I was pleasantly surprised about. One was when I was in Abu Dhabi, they did a great job of rolling out HPV vaccination programs in their schools. And most people wouldn't expect that. They were very adamant about cancer screenings like breast cancer, pap smears, and colorectal cancer and mammography, to the point that they made sure that the folks who received the local insurance had those things done before they received their insurance card. So it was an incentive in a way and an encouragement for them to get their proper screening tests. I was impressed by that. The second thing that was surprising to me was that I could walk into a pharmacy and buy birth control pills over the counter for less than
Mm,
$5 a pack. And this is supposedly a, somewhat conservative Muslim country. And
mhm,
you couldn't do that in the United States when I left.
mhm.
I mean, you can do that in some places, but I'm talking about the prescription type birth control that we
Yeah,
get now. You can walk into a pharmacy and get.
that's incredible. Wow. I can just imagine, seeing, and I think to your point, that just probably fueling so much of the kind of the need for change or just the need for acceleration that you've been seeing. And I'm also really curious. I know you kind of mentioned, the role of technology or really just broader innovation and how that really needs to almost be fast tracked here in the States. I would imagine, like being involved in the conversations as a clinician is probably so important. And I'm so curious, from your perspective, why, like, how do we kind of bring clinicians earlier on in these conversations about innovation, about, technology, maybe for the startups that are listening right now, that are wanting to make an impact in this space? Why is it very important to kind of have that clinical or clinician voice?
Yeah, I mean, as a leader, one of the things is I think I have sort of a perspective and objective that surpasses the average clinician. But
Hmm.
one of the things I think is important is as clinicians, we see the problems, right? We
Yeah.
know what needs to be addressed. And we also communicate with the patients because the patient or the woman whose problems we're trying to solve, their voices need to be heard in that. And to get clinicians engaged, I think a lot of clinicians don't even know it's an opportunity, right? I have the unique opportunity to sit in New York Presbyterian, well, Cornell, but we also partner with Columbia, and we have this huge ecosystem that supports innovation, not
Mm-hmm.
just within Cornell Medicine, but we also partner with Cornell Tech, and we also partner with Cornell University. So we have
Wow.
lots of opportunities to engage, to network, to collaborate, and I am trying to, in my department, uh, enable that networking and support and connection. And we have a lot of early things that we're doing that I'm very excited about.
That's incredible. I definitely want to dig more into that. But I think one thing that you also mentioned is really kind of the leadership aspect of it as well. I know you yourself are a leader, and I think when you were saying that some clinicians don't even know that that's an option or something that they can pursue. How can we better empower physicians to take on leadership roles, whether it's advisory roles in startups or even within their own departments? What do you think is kind of the next steps needed?
Yeah, I think one is mentorship, and it starts with the residents. One of the things I just started with I have a great residency program director, and we often talk about the things that we can do to provide our residents with opportunity and at least allow them to know the different options out there. So I just gave a leadership lecture to them recently, and we're going to do a leadership series. The other piece is mentorship.
Yeah.
The other piece is networking and introductions. We have a new menopause provider in our department, and I've connected her with a menopause researcher from Cornell University. And that's
Mm.
sort of one of the early things that I mentioned about that I'm excited about is all of the collaboration with from the various disciplines. So
Yeah.
I think it's networking and introductions and just thinking big, right?
Hmm. I love that. Yeah, I think sometimes I think there is that perception that I hear where those that kind of practice in medicine, like you're in the details, you're in the weeds, like you go so deep on your discipline. But just kind of seeing the opportunities to go broad is always, I think, a great step. I love that. One of the things I'm also really curious about, I think, you had mentioned really seeing a lot of the stagnation. And I think, we all see the stats about, women's health not being funded when it comes to the VC landscape. We see all of these really alarming stats that kind of speak to how there just doesn't seem to be a lot of opportunity. Would love to kind of get your thoughts on when we think about healthcare innovation, women's health being such like this perceived niche of a topic, would love kind of your thoughts on just the broader like healthcare innovation startup landscape and the way women's health kind of fits into that.
I think women's health is a huge opportunity for startups and innovation
Hmm.
because there's such a big need. And women's health in general has been undervalued, both by insurers, funding, and even health systems. I mean, I often have to remind people in meetings that I'm in is that, women are not pregnant most of their lives. So we need to have
Yeah.
discussions around women's health unrelated to pregnancy. Pregnancy is important, and maternal health is very important, and it's one of the things that we're focusing on. But a woman is independent of her ability to carry a pregnancy. So there
Mhm.
are a lot of things that we need to think about and address. So leadership makes a difference, and women in leadership roles, I think, will make a difference. And you know that, especially in OBGYN, there's a majority of OBGYNs are now women. And yet, when you
Mhm.
look at the leadership roles, there are less of us than you would expect. But the
Mm.
more of us in those roles, the more of us can force these conversations about women's health research and proving that there's a value to developing technology and innovative approaches to address women's health. Plus, women are leaders of their family. So who
That's
decides where the family goes for healthcare? The
Mhm.
woman does. She takes her parents, she takes her husband, she takes her children. So we are the lead in terms of engagement with the family. So health systems should recognize that the power that women have in bringing her entire family to take advantage of the health services provided.
I love that 100%. There's so much benefit to that. And I like how you were really outlining not only the fact that there's this need, but also earlier kind of speaking to here are the ways to really empower physicians to kind of step up and play that role through mentorship, networking, all of that. So it's amazing to see it full circle because that was like very inspiring to hear. One of the things I'm so curious about, I mean, when you were kind of speaking to, I think it resonated with a lot of folks on the call that women are, to your point, more than just the ability to have children, knowing that of course maternity is significant. I'm kind of curious, are there any specific, areas of women's health that you are excited about that you think are really ripe for innovation, for disruption? Would love your thoughts on that.
Yeah, I mean, I think first let's talk about areas of disparity um,
Yes.
and preventable diseases and preventable cancers.
Hmm.
Cervical cancer prevention is one of them. It's shocking to me that we still have advanced cases of cervical cancer. Despite having the tools, we have the tools to prevent advanced stage cervical cancer. So implementation of cervical cancer screening and management guidelines and
Hmm.
surveillance, that's one big area. Because I work in Brooklyn, the other thing, and I'm, a Black woman, one of the other things that's shocking to me is the uterine cancer rates are increasing, especially in Black women. They
Hmm.
tend to have some more aggressive cancers, but even if they have the same cancer as their white counterpart, their outcomes are even worse. And in
Hmm.
my view, uterine cancer was one of the most treatable early, and you could detect it early. So it's shocking to me that there's so many deaths from uterine cancer. And so
Yeah.
this is another area that's ripe for um, innovative approaches. And
Hmm.
just diabetes, hypertension,
Right.
but even operational efficiency in healthcare systems. There is a lot of dysfunction in healthcare systems, and it's frustrating for patients.
Hmm.
It's frustrating for providers. And so I think those are opportunities for us to do a better job of efficient delivery and even just changing the way that we deliver healthcare and even
Yes.
our mindset of how healthcare should be delivered.
100. It's funny. I was going to ask you because knowing the work that you've done kind of with the community when it comes to preventable, gynecology obstetrics, I was going to ask you what are some of the barriers that you've been seeing or some of the challenges. But to your point, it seems like, just an inefficient healthcare system more broadly is probably one of them. But I'm also curious, what are some other kind of big challenges that you see to your point of kind of getting access to care where maybe we have like the clinical modalities, but of course we have to recognize access, affordability, all of these things, play a very significant role.
Absolutely. So that was one of the things that was interesting to me when I got to New York City was how challenging it is for a woman to get in for gynecologic care.
Mm.
Right. I mean, if you call and you have a GYN problem, typically it takes anywhere from 4 to 8 weeks to get in, which is ridiculous.
Yeah.
Right. And so if you're talking about intervening when people have problems, abnormal bleeding is one example. That could be
Mhm.
cancer, it could be fibroids, it could be polyps, it could be anything. So just trying to think creatively of how we can improve that access. So we hired advanced practitioners who partnered with the physicians and we establish programs. And one of our programs is an abnormal uterine bleeding program. And the goal is that if a woman calls and she has abnormal bleeding, we get her in within a day or two based on her schedule. And that's one small thing that we've done to try to improve access in Brooklyn.
That, I mean, that alone, I can imagine is so impactful. I'm so curious, for maybe folks on the call that are, working within a healthcare system, what to stand something like that up. I mean, I'm sure was no, was no easy feat, but it was something that was significant. What did it take to kind of, galvanize people to build out a program like this?
Yeah, I mean, I think it gets back to leadership, being able to
Yeah.
define the problem,
Hmm.
show how it's beneficial to the health system, motivate people to buy into your dream, and then the providers want to provide the care. I think the employing advanced practitioners was something that was new, but it's also important to train them well. And so we had the good fortune of hiring some really early career advanced practitioners, and I, as well as a lot of my faculty members, engaged in the training, and they work alongside us, and they feel very comfortable coming to me for anything, or the other providers. They see something, they pull us into the exam. So the patients need to be comfortable that they're going to receive the same level of care. A lot of what we do as gynecologists is routine and can be managed by an advanced practitioner. Um,
Hmm.
and as long also the advanced practitioner having the support that she needs. So if it's something she can't manage, there's someone right there to help her out. It's still a work in progress. We're continuing to make progress, but we do. I think that's one successful program. We have a few other programs that we've also implemented.
Wow, that is incredible. And to your point, I think it just speaks to really the power of having leadership that can, be that advocate, but also is kind of seeing it through from implementation, training, all of that. So I mean, that's incredible. Congrats. That sounds like a very, needed program.
Yeah. Mhm.
I love that. One of the things that I'm also very kind of curious about is your experiences, your insights, being a provider and kind of seeing patients in an era of, technology, internet misinformation, have you
Mhm.
kind of seen any interesting insights as it relates to just health literacy more broadly
Oh
with,
gosh.
an era of
Yes.
IT?
I mean, and the health literacy is been a chronic thing because even when I was in private practice, it was something that I was challenged with. I even wrote this book because I was like, let me just write down everything that I would want a woman to know if she's having this problem at this time in her life. But it's challenging because people don't read books anymore. They look at TikTok videos, which is fine. And so, yes, health literacy knowledge, the knowledge to be able to make decisions to partner with healthcare providers, that is a challenge. They don't know who to trust.
Yeah.
I'll give a great example of seeing a patient who came and wanted a pap smear. She'd had a pap smear with HPV testing every year for the past, I don't know, 5 years. All
Mhm.
of them were negative. She didn't need to have it every year, but she insisted on having it every year. I get it. I tried to get into a conversation about cervical cancer prevention, and the most
Mhm.
valuable thing that could be done was an HPV vaccine, which she qualified for, but she didn't want the vaccine. So I'm like, okay, the thing that I recommend you don't want. The thing that you want, I don't recommend.
Yeah.
We're at an impasse here, but it's really about that knowledge and knowing who to trust. So we're trying to
Mhm.
work on some novel ways to deliver short clipped
Oh.
animations or videos around specific things. I want to do it for obstetrics. I'm trying to do it for gynecology. Um, People just need to know who's a trusted source. And
Yeah. 100%. And I think it's kind of interesting because I mean, just for me as a consumer of the internet, there's kind of an aspect of the trust. And then you also hear so much like language around, like whether it's supplements or kind of natural and things like that. And I think it's kind of that balance because there are some things, luckily being in the healthcare space, I can kind of I have a little bit of discernment, but I could imagine if you kind of didn't already have that privilege, it can be kind of challenging to navigate. So it's great that you are kind of putting out different types of media.
yeah, and you're right, it is challenging to navigate. So I think that's one thing for innovations and technology and startups. I think it's important for whatever it is that we're doing, there's evidence. So, in clinical research, we're talking about evidence-based approaches. And so we need to make sure that we take an evidence-based approach to whatever product that we're trying to produce that we say it's advancing the health of women. And there's lots of ways to do that. And if it's not evidence-based, then that should clearly be communicated to the patient, right? Because there are a lot of things that we do in medicine that may not necessarily be evidence-based because no one's done the proper studies, but women need to know that.
Yes, 100%. I also recognize, I know we are going to have a little bit of a shorter session today. So the time is just flying by. Dr. Denise, we need to have you back to chat even further. But the last question I wanted to ask you, which is one of my favorite questions, is if you have, any words of wisdom, any messages to share to maybe folks, on the call that are really passionate, that kind of want to rise and be a leader to impact the change that, that they see. Any general career advice for them?
Yeah, I think one thing is know your area, whatever it is, become an expert in your area. I think also network. And if you're trying to solve a problem, make sure it's a problem that the person or women that you're trying to impact also perceive it as a problem, right? Because, right. So let's address problems with appropriate solutions and not have solutions that we're trying to force fit to some people's problems.
I love that. Well, thank you so much for taking the time to chat with us today. Already, I feel like I gained so much knowledge. So I really appreciate you stopping by. Thank you so much, Dr. Denise.
Thank you. I appreciate it.
Make sure you join us next time for our next Women's Health Tech Wednesdays. I wanted to give a quick shout out to our sponsors for sponsoring this conversation, as well as one last huge thank you to our guest. We will definitely need to have Dr. Denise back for kind of a part 2, and we will see you all next week. Bye, everyone.